All right, so next one. Restraint requirements, right? That's 39. So, how do we get a restraint?
You have to have an order.
Yeah, you need a doctor's orders, right? That's important to remember. And then also, this is the last resort we use. We try every other intervention. Like, we'll put a bed alarm on, we'll have them close to the nurse's station, we'll have a one-on-one watch, and then we'll go to restraints. So if you have restraints on, what do you want to make sure you do?
Check on them every 15 minutes.
Yeah, check them every 15 minutes. What are you checking for?
Bed sores.
Yep, pressure sores. Yep, bruising. Okay, and then you want to make sure also you take them off every 2 hours. Okay.
I guess you wouldn't really want to use them if you have to check them every 15 minutes.
Yeah.
Like,
But I mean, if you're going to get them every 3 minutes out of the hallway,
yeah.
yeah. Okay.
Have you ever seen them used?
No. The closest I've seen is CNA had to sit in the room the whole shift, just watching them. Just sit there forever. So, yeah.
Horrible.
It's a long thing.
Yeah. Okay. Oh,
Sorry.
what were you gonna say?
No, I went on an ambulance call where like the cop like actually handcuffed combative, and it wasn't like it was being arrested, but like handcuffed them to the cot. Like, yeah.
Oh,
Yeah.
wow.
Like, it was really freaky.
What happened to the patient?
She was just, she was drunk. She was
Oh,
walking
just not
around,
cognitive.
So, yeah, and I think she had like some mental issues going on. But
Yeah.
it was really scary, like, because I had to hold her down while he did it. I was like, but
Yeah.
then we took the handcuffs off and put on the soft restraints too. So
Yeah. This
It was
is
really
definitely like
sad.
cut you and stuff.
I know.
I just said I had to like one time a cerebral palsy patient. She would always like if you're doing anything to her, her reaction of not liking it, she'd bite herself right here. So she had tons of scars. So I had to like hold her while we were like wiping her bum because she made bowel movement. She like almost bit off my hand like 8 times. Cause I was like, she was pretty big. I know, it's sad.
My mom's knocked out drunk people with a clipboard before at the ER. Like the
Really?
police will just bring them in, and she was like, there was like a couple nights like where there was just no male nurses or anyone to restrain them, so she just knocked them out with a clipboard because they were like attacking her. So she just smacked them, and then got them into bed and restrained them. And they woke up.
He laughed at my face.
That's awesome.
I just like picture that. Have you seen Monday Mornings? It's like this doctor show. So I just picture that, just like. Okay.
My mom has great stories.
Is your mom an ER doctor?
Yeah.
And what's your dad?
Internal medicine.
Oh, cool.
I don't know what he specializes in.
Yeah. That's cool.
Well, my
Wow.
parents are divorced now. No, my dad. So.
Oh, yeah. She must have crazy stories all the time.
Oh yeah.
Are you gonna work in the ER?
I want to try it out. I don't know if I'll like it as much as she does, but I
Yeah.
definitely want to try it out.
That's cool. Okay, so next one is fall precautions, number 40. So what kind of patients do we want to implement these on?
You have to use that scale, right? There's a scale to calculate who's a
Yeah,
fall risk.
it's called, what is it called? I think it's called the Braden scale or something. No, that's for skin. I forget what it's called, but I don't think you have to know what it is. Fall risk though, what is it? Oh, now it's bugging me. Do you remember?
It's
No. Is it VTE? No, that's blood clots. I don't remember. Maybe it's just called the fall risk scale. Anyway, it's gonna bug me. Okay, for this though, mostly elderly people, you want to make sure that they have a fall risk band on them. Make sure that they have a sign in front of the door so everyone knows their fall risk.
Is it Morse? That's what this says.
Morse? I don't recognize that.
Oh, I remember learning about the Morse scale, and I think that might be that's what it is. Because I remember being like Morse code, and then I wandered. I do that. It was early
Did
in
you
the
hear
morning.
that? Yeah. Okay, so mostly elderly people like we just said. Bracelet, sign on the door. Something else you can do is you really want to make sure their environment's safe. So you want to make sure they have adequate lighting, especially if they're up, moving around. Make sure they have side rails on like the toilet and then on the bathtub to hold on to. Make sure they have their like assistive devices close by, like their walker, their crutches, wheelchair. Most importantly too is like the 4 safeties we always do. So like bed in lowest position, side rails up, brakes applied, call light and reach. And remember with the call light, if their call light goes off, go there fast, just because they could not wait for you and try and get out of bed. But they need your help.
I had a patient like that. I was just outside the door, and like I went in right away, and he was like already halfway to the bathroom.
Exactly. Like they don't wait for you, right? And they're falling on the ground.
Yeah.
Isn't clinical fun? Do you guys like it?
Yeah.
You just feel like,
I love it.
yeah, it gets
I
better.
like it way better than like lab.
Oh, yeah.
We don't have lab next semester, do we?
You have 2.
We have lab on Wednesdays. It's a psychiatric lab, and then
Next semester?
yeah, that's. What
Oh,
our schedule
that just
says.
means orientation. So you go to the State Hospital South and they just orient you to the place.
Wait, you have 2 labs for the semester or
Mhm.
2 a week?
Semester.
So does that mean we get
Awesome.
Wednesdays off?
Every week.
We'll be like
Yes!
studying our brains off.
Yep. It'll be nice, and then you'll sleep in. Yeah.
But
How
how
many
many
times
times
do
do
you
you
have
have clinicals?
Twice a week, 2
It
6
is
hours.
Just like this. Just like
So
this.
it's the same amount of time. Throughout the program, we always have 12 hours or something.
I have it spaced so that I have Monday and Wednesday, Friday, I don't have anything but just like lab and clinical.
I wish I had.
That's like everyone. You all have that.
But I mean, I have my other
Oh.
classes Tuesday, Thursday.
That's smart.
See, I have a sociology class Monday night,
Oh.
and it's a hybrid, so I have to go Monday.
Shoot.
Sociology is fun.
Yeah.
I
Okay.
want to get licensed in California if I need to. So.
That's what I did. I was like, just in case.
Yeah.
Then I ended up going to California.
Well, I
So.
just entered a college sociology class in high school, and then I was like, oh, cool, I already took it.
Oh, sweet. That's awesome.
See, I did too, but like California won't get back to me to see if it transfers or not.
Oh, really?
So I'm just taking it because I've been literally pestering them about it for 6 months now, and they will not get back to me.
Oh, yeah.
And
That's
Brother
close.
Wagner was just like, yeah, they tend to not get back to people, so I would just take it.
Yeah. Okay. So fall precautions. You also want to make sure that you have the pathway from the bathroom to the bed clear, like no cords, no obstacles, because that's where they're going to be going most often, especially in the night when it's dark. You also want to make sure that the room is tidy, no throw rugs. Make sure they're wearing sticky socks or shoes. Ambulating, make sure they have a gait belt. It's also important to dangle them, right, so they don't get really dizzy and fall over. So. Okay, and that will be pretty easy on the test because we kind of know like what is going to make someone fall or not. So, okay. Sorry. Next one is seizure precautions. So, I'll just see. Okay, for this one, basically the number one thing in a seizure precaution when someone's having a seizure, you want to make sure your airway, breathing, circulation, right? ABCs. That's the first thing. Especially airway. You want to make sure that's patent. When they're starting to have a seizure, make sure that their surroundings are all safe. There's no chair to bump into. They're not going to hit their head on anything. And then if they have any clothes that are restraining them or like super tight, just kind of release those clothes. What else? Sorry, I'm trying to think. With these patients, I'm like so out of it right now. I'm really sorry. Like I know one time this patient had a seizure every time she saw the water or after, so we went swimming, obviously, because I was smart. For Journeys, do you guys know what Journeys is? They have like disabled people. So it was super fun. And then after she was with a seizure, so we were in the change room, both of us in like swimsuits. And she just like had a seizure for 45 minutes. So I was just like holding her for like 45 minutes. But she kept going like this, so we kept to lift it up just so she could have a good airway. So airway is super important. If they're laying on their back, maybe try and tilt their head a little bit, so in case they aspirate. You basically just have to wait it out though, because there's nothing we can do. Also, if they're really prone to having seizures, make sure you pad their bed. So you just take blankets and put tape around them. Make sure the padding, just in case they hit anything. And then you also want to make sure that right when they have a seizure, make sure you keep track of like how long it's been going on for, what might have started, anything that's going to help the doctor diagnose that. So also, if they keep having seizures, you kind of know what's going to, like when it's about to happen, because you kind of notice those pre-signs. Okay, and then the number one thing though is airway, so. Okay.